Start. Definition of constipation. We all know the common definition of constipation but today we have got the Rome 4 criteria for constipation. It includes a patient must have experienced at least two of the following criteria in the preceding 3 months, and it has to be present in at least 25% of the defecation attempts that he or she has made. And in the slide, we can see the criteria. Fewer than 3 spontaneous bowel movements per week, straining, lumpy or bloody stool, sensation of anorectal obstruction or blockage, sensation of incomplete defecation, and manual maneuvering required to defecate. And it has to be present at least 25% of the defecation attempts. Now, we are going to have a look at the different meaning of constipation that people have, like passage of hard stool, less volume stool, bowel movements not every day, incomplete evacuation, any abdominal outwardness. This is not according to Rome 4 classification. This is just the general aspects of constipation among people. So epidemiology. Around 28% of the people in the world, they suffer from chronic constipation. In Bangladesh, the rate is a bit lower, it's 11.8%, and out of them, 2 out of 3% of them are women. The burden of constipation. Almost 85% of physicians visit for constipation that results in a prescription of a laxative. Adults over the 35 years have a higher chance, and 35% of IBS patients, they suffer from IBS-C. This is the Rome 4 classification for constipation: functional constipation, IBS-C, opioid-induced constipation, and evacuation disorder. Irritable bowel syndrome. As you all know, this is a very common disease which is defined as a chronic, often debilitating, and highly prevalent disorder of gut-brain interaction. And we are again going to refer to Rome 4 diagnostic criteria for irritable bowel syndrome, and it includes recurrent abdominal pain on an average at least once per day in a week in the last 3 months, associated with 2 or more of the following criteria. It must be related to defecation, associated with a change in the frequency of stool. It should be associated with a change in the form of stool, and these criteria should be fulfilled for at least 3 months, with symptoms onset at least 6 months before the diagnosis is made. There is a difference between chronic idiopathic constipation and IBS-C. Cause. CIC is either idiopathic or secondary causes, where IBS-C is altered GI motility, GI hypersensitivity, psychosocial factors. Primary symptom of CIC is constipation, while primary symptoms a bit later. Secondary symptoms include in CIC is abdominal pain, bloating, itching, and bleeding. In IBS-C, the secondary symptom here, the constipation is a secondary symptom along with bloating. There is an overlap between CIC and IBS-C. According to Rome 4 classification and definition, IBS-C patients are more likely to predominantly have abdominal pain in comparison with CIC patients that we discussed in the previous slide. However,